Have you ever wondered why the heart, a small organ roughly the size of your fist, is so crucial for our survival? It's a question that invites us to delve into the fascinating world of the human heart and its functions. The heart, our body's tireless workhorse, operates as a pump that propels blood throughout our body. Composed of 4 chambers, the right atrium, the left atrium, the right ventricle, and the left ventricle, it functions with a rhythmic contraction and relaxation process known as the heartbeat. But the heart doesn't function in isolation. It's part of a complex system, and its rhythm and pressure are intrinsically intertwined. The heartbeat is the number of contractions made by the heart in a minute, while blood pressure refers to the force exerted by blood on the walls of blood vessels. A faster heartbeat results in more blood being pumped, thereby elevating blood pressure. Conversely, a slower heartbeat results in less blood being pumped, thus lowering blood pressure. As we age, our blood pressure can rise due to several factors. Decreased elasticity of blood vessels, leading to narrower, stiffer passageways. Accumulation of plaque or fat inside the vessels, causing constrictions or blockages. Impaired kidney function, leading to increased fluid and salt volume in the body, and decreased production of blood pressure regulating hormones like renin, angiotensin, and aldosterone. High blood pressure can trigger a host of complications such as stroke, heart attacks, heart failure, kidney failure, and eye diseases. Therefore, it's crucial to keep blood pressure within normal limits by adhering to a healthy, balanced diet low in salt, fat, and sugar. Exercising regularly, at least 30 minutes a day, 5 days a week. Avoiding smoking, alcohol, and excessive stress. Maintaining an ideal body weight, and regularly checking blood pressure and taking prescribed medication. To summarize, the heart is a remarkable organ that works as a pump to circulate blood throughout our body. It functions through a rhythmic contraction and relaxation process known as the heartbeat. The heart's function and rhythm are closely tied to our blood pressure, and maintaining a healthy heart and blood pressure is essential to avoid complications such as stroke and heart failure. So next time you feel your pulse, remember the extraordinary work your heart is doing every second of every day. It's a little reminder of the intricate and beautiful machinery that keeps us alive and well.
Ever wonder why blood thinners play such a crucial role in medical treatments? Well, it all boils down to their unique chemical process. Understanding this process can shed light on why these medications are lifesavers for many patients worldwide. Blood thinners or anticoagulants are medications that reduce the formation of blood clots. They function by interfering with the body's natural clotting mechanism, a complex process that involves a series of chemical reactions. In a simplified explanation, when a blood vessel gets injured, the body responds by forming a clot to prevent excessive bleeding. This clotting process involves platelets, a type of blood cell, and proteins in the plasma, the liquid component of the blood. Aspirin, a commonly used blood thinner, works by inhibiting a substance called cyclooxygenase. This substance helps produce thromboxanes, chemicals that stimulate platelets to stick together and form a clot. By inhibiting cyclooxygenase, aspirin prevents the formation of thromboxanes, thereby reducing the likelihood of clot formation. Now let's delve a little deeper. The inhibition of cyclooxygenase by aspirin is irreversible, meaning once the enzyme is blocked, it remains blocked for the lifetime of the platelet. This is why the effects of aspirin last longer than the drug stays in the bloodstream, and why it's often prescribed for long-term prevention of blood clots. On the other hand, other blood thinners, such as warfarin, work by interfering with the action of vitamin K, a vital component in the production of clotting factors. By reducing the body's ability to use vitamin K, warfarin decreases the production of clotting factors, hence slowing down the clotting process. To encapsulate, blood thinners work by interrupting the body's natural clotting process. Aspirin achieves this by inhibiting the production of thromboxanes, chemicals that stimulate clot formation, while other blood thinners like warfarin interfere with the production of clotting factors by affecting the action of vitamin K. This intricate yet fascinating chemical process is what makes blood thinners such an essential part of many medical treatments. It highlights the wonders of medical science and the profound impact it has on improving and saving lives every day.
Ever wondered how doctors manage to open up blocked arteries and help the heart pump blood more efficiently? Well, today we're going to delve into the fascinating world of heart stent placement. A heart stent is a small, expandable tube that acts like a scaffold to keep the artery open, ensuring a healthy blood flow. But how does this tiny device find its way into your heart? The journey it takes is nothing short of remarkable. Firstly, a tiny incision is made, usually in the patient's groin, wrist, or arm. This is where the catheter, a small flexible tube, enters the body. The catheter is the vehicle that delivers the stent to its destination. With the precision of a skilled driver, the doctor navigates this catheter through the body's intricate highway of blood vessels all the way to the heart. Once the catheter reaches its destination, the doctor injects a special dye that makes the blood vessels visible under an X-ray. This allows the doctor to identify the blockage and plan the stent placement. Next comes the balloon angioplasty. A smaller tube with a tiny balloon on its tip is threaded through the catheter. When this balloon reaches the blocked area, it inflates, pushing the plaque against the artery wall and creating space for the stent. Now, it's showtime for the stent. It's mounted on the same balloon and guided to the newly cleared area. As the balloon inflates, the stent expands, locking into place and acting as a permanent scaffold to keep the artery open. Once the stent is securely in place, the balloon is deflated and removed, leaving the stent behind. The doctor then carefully withdraws the catheter and the incision is closed. A successful stent placement can provide immediate relief from symptoms like chest pain and shortness of breath. So to summarize, heart stent placement is a minimally invasive procedure that involves making a small incision, navigating a catheter to the heart, identifying the blockage with dye, clearing the blockage with a balloon, and placing the stent with the help of the same balloon. While it may sound complex, in the hands of skilled medical professionals, heart stent placement can be a life-changing procedure that helps restore normal blood flow to the heart, reducing the risk of heart attack and improving overall heart health. Remember, knowledge is power, and understanding the procedures that can keep our hearts healthy is a step in the right direction. So, keep your heart pumping, keep learning, and keep living life to the fullest.